Hello, and welcome to my action research proposal titled Enhancing Nursing Orientation Programs Through Action Research. My name is SAnness, and today I'll present my proposal for improving nursing orientation programs, highlighting my research methods, findings, and proposed solutions to current challenges. So I am going to do my student attestation. So all Aspen University students are required to abide by Aspen University's academic integrity policy as outlined in the university catalog. The academic integrity policy is built upon the concepts of honesty, truth, fairness, respect, and responsibility. By taking this exam, I agreed to abide by both the academic integrity policy and the rules outlined on this exam. With this recording, I am attesting that I have personally completed the comprehensive exam and that the information I submit is true and accurate to the best of my knowledge. And then here is my, oops. Okay. So, nursing orientation programs are fundamental in shaping the clinical readiness of newly hired nurses, providing them with the necessary skills, knowledge, and confidence to transition into practice. A well structured orientation program ensures that nurses feel prepared for their responsibilities, promoting professional competence and patient safety. Despite this importance, many orientation programs exhibit significant shortcomings that hinder their effectiveness. So, one major issue is the inconsistency in training methods across different healthcare organizations. There's also an absence of standardized protocols, and some, for example, programs may emphasize technical skills while neglecting critical components such as decision making, teamwork, and patient communication. Um, and in addition, the lack of structured mentorship leaves new nurses without adequate guidance and support, which can lead to them feeling uncertain and under a lot of stress, having to navigate this new process by themselves. Another thing is cultural competency. It's really important to integrate into orientation, and it's often overlooked, especially under the orientation lens. So, as healthcare settings become increasingly diverse, new nurses must be equipped with the skills to communicate effectively and provide culturally sensitive care. Without adequate training in cultural awareness and inclusive patient care practices, nurses can struggle to meet the needs of diverse populations, which can impact health outcomes. The consequences of ineffective nursing orientation programs go beyond individual nurse performance. Studies indicate that poor orientation experience contribute to higher turnover rates, decreased job satisfaction, and increased levels of burnout among new nurses. So this places strain on the hospitals, um, as well as it's costly to um, recruit new nurses if you're losing them and not supporting them in their new orientation process. So, to address these gaps, an evidence based approach is essential. Action research provides a structured framework for continuously assessing and refining nursing orientation programs to ensure they meet the evolving needs of new nurses and healthcare organizations. So, by employing a participatory and iterative process, action research enables stakeholders, which include in this case newly hired nurses, preceptors, educators, and administrators, to work collaboratively in identifying challenges, develop tailored interventions, and implement solutions that enhance the overall effectiveness of orientation programs. So, using this approach, organizations can create adaptable, specific improvements that can enhance nurse readiness, retention, and have ultimately better patient care outcomes. So, despite the fundamental importance of nursing orientation, many organizations struggle to implement effective, standardized training programs. So, newly hired nurses frequently report feeling underprepared for real world patient care due to inadequate mentorship, limited hands on experience, and challenges related to cultural integration. So, we know that because of COVID-19, a lot of clinical placements were canceled for students. So, the newly hired nurses coming right now might have had a decrease in their clinical experience. And so they also might feel underprepared because of that. So, this lack of preparation leads to increased stress levels, lower retention rates, and decreased job confidence. In addition, hospitals and healthcare organizations often lack standardized competency evaluations, making it challenging to assess and address the needs of new nurses. And so, this research aims to identify these limitations and propose structured practical interventions that can significantly enhance the effectiveness of nursing orientation programs. So there are three research questions. The first, how effectively do current programs prepare nurses for patient care? The second, how can structured mentorship, cultural training, and hands on learning enhance orientation effectiveness? And the third, what evaluation methods best assess long term outcomes related to nurse retention and competence? So, to address the issues identified in the problem statement, this study looks to use the look, think, act cycle proposed by Stringer. The intervention strategy includes scenario based learning, simulation exercises, structured mentorship programs, and cultural competency workshops. Participants in this study include newly hired nurses, preceptors, nurse educators, and administrators. Data collection will incorporate surveys, focus groups, direct observation, and document analysis. So, by engaging key stakeholders, this research ensures that proposed improvements are practical, sustainable, and relevant to real world nursing challenges. A review of existing literature highlights the effectiveness of structured mentorship programs, hands on experience, and cultural competency training in improving nursing orientation outcomes. So, studies by Ernawade et al., um, Tawash et al., and Singh et al. Indicate that hospitals with structured orientation frameworks experience lower turnover rates, increased job satisfaction, and improved nurse confidence. Some research also points to existing gaps in coaching and evaluation methods, indicating the need for continuous program refinement. So the study will use the look, think, act cycle of action research. So during the look phase, data collection will occur using surveys, focus groups, direct observation, as well as document analysis. And then we will move on to the think phase, which will include analysis of collected data to identify patterns, strengths, and weaknesses within the current orientation program. So we'll really look at the gaps there based on what the current process is versus what the literature suggests. And then during the ACT phase, will be the implementation of interventions, continuous evaluation, and program refinement. So, stakeholders involved in the study will include 30 newly hired nurses, 10 preceptors, 5 nurse educators, and 3 administrators. Data sources will include self report questionnaires, structured focus group discussions, competency assessments, and training program audits. The main data will come from semi structured interviews. It's going to take a qualitative approach. And so, data will come from semi structured interviews, transcripts, as well as observational notes. I'm going to use a thematic analysis to review the data. Additionally, a document analysis of orientation materials will be conducted to identify gaps in hospital training programs. And by triangulating multiple data sources, the study ensures a comprehensive evaluation of orientation program effectiveness. So, to gain deeper insights into the experiences of newly hired nurses, a semi structured interview approach was conducted in this hypothetical research. And the qualitative data from these interviews revealed several key themes regarding the effectiveness of nursing orientation programs and the challenges faced by new nurses. So, the first theme is inadequate preparation and competence gaps. One of the most prominent themes identified was the lack of adequate preparation provided by orientation programs. Many newly hired nurses reported feeling overwhelmed and underprepared for the realities of patient care, especially when dealing with high patient loads and complex clinical cases. Participants frequently mentioned that while theoretical knowledge was covered during the orientation, practical application remained limited. As one participant stated, I knew the protocols, but when I had to make quick decisions in real time, I felt completely lost. The next theme is the role of mentorship in confidence building. And a significant finding was the impact of mentorship on new nurse confidence. So, those who had structured mentorship programs reported feeling more supported and capable in their roles. Conversely, those without designated mentors struggle to find guidance, leading to higher stress levels. One nurse shared, my mentor made all the difference. She was there to answer my questions, guide me through difficult cases, and reassure me when I doubted myself. This reinforces the importance of a structured mentorship program as an important role in the orientation process. The third theme is cultural competency and workplace integration challenges. So, new nurses working in multicultural settings frequently cited difficulties in adapting to diverse workplace cultures. Language barriers, differing communication styles, and varying expectations about patient care created challenges for both native and international nurses. Participants noted that orientation programs often overlook cultural competency training, leaving them unprepared for cross cultural interactions. A participant described her experience. I struggled to communicate with some patients due to language differences, and I wasn't sure how to approach it professionally. This finding highlights the need for cultural competency workshops within the orientation process. The fourth theme is simulation-based learning as preferred training method. So nurses expressed a strong preference for simulation-based learning, noting that it helped bridge the gap between theory and practice. And those who participated in high-fidelity simulations felt more confident handling real-world situations. So one participant explained, practicing emergency response in a simulation helped me react better when I faced an actual patient crisis. This aligns with research that highlights the effectiveness of simulation training in nursing education. The last theme is stress and burnout during transition. So, the transition from student to practicing nurses was marked by high stress levels, with some participants expressing feelings of their burnout within their first few months. A lack of structured time management training contributed to feelings of being overwhelmed. And as one nurse noted, it felt like I was constantly behind. No one taught me how to manage my workload efficiently. This suggests a need for resilience training and stress management techniques in orientation programs. So, the overall implications and refinements from these results include that the findings emphasize the importance of refining nursing orientation programs by incorporating structured mentorship, enhanced cultural competency training, and increased hands on learning through simulation. The emerging themes suggest that addressing these areas could lead to improved nurse retention, greater job satisfaction, and ultimately better patient care. So, given action research's iterative nature, a second cycle is recommended to refine the interventions further. The next phase will optimize mentorship pairings, integrate stress management techniques, and introduce digital learning platforms to complement hands on simulation. Continuous stakeholder engagement will guide these refinements to ensure long term sustainability and scalability. So, this study contributes to the broader field of nursing education by reinforcing the importance of structured mentorship, cultural competence training, and hands on learning experience. The findings align with existing literature and highlight the potential for improved nurse retention, job satisfaction, and patient outcomes. Healthcare organizations worldwide can benefit from adopting evidence based orientation frameworks tailored to the diverse needs of both the population and the newly hired nurses or the nurse workforce. Future research should explore the long term impact of mentorship and digital learning enhancements on new nurse performance and well being, especially with a focus on the orientation process. So, the most critical takeaway from this study is the importance of continuous stakeholder engagement in action research. And Stringer emphasizes that participatory approaches lead to sustainable improvements. So, by involving nurses, educators, and administrators in ongoing program evaluations and refinements, organizations can ensure that orientation programs remain effective and relevant. So it's really important to create those feedback loops, allowing for adjustments that align with the evolving needs of the healthcare organization.